Hey, so you remember when Bill Gates told the truth about how serious COVID was, how deadly it was?
And then at that point, we didn't really understand the fatality rate. We didn't understand that it's a fairly low fatality rate and that it's a disease mainly of the elderly, kind of like flu is, although a bit different than that. And
so he's saying that about COVID. Turns out, hey, we had everybody was pooping their pants over COVID because we were trying to scare the hell out of everybody to get everybody to take a vaccine that I had invested $55 million in and I was about to make $500 million off of. But now it turns out it had a low fatality rate. And it was kind of like the flu was really just the dangerous to old people like a flu. Anyway, I made $500 million and you all got to be locked down and lose all your money and all your businesses closed and your lives were a living hell and everything, but I have a private jet and now I have $500 million more because of all that stuff. Anyway, turns out didn't need it. It wasn't about it. But so what is the fatality rate? Well, a new study from the Dr. Jay Bhattacharya said this guy was his colleague and he's the most cited doctor in the world. So do you pronounce his name? I don't know how to pronounce his name. Take a stab at it, Kurt. You're usually good at this.
Ioannidis.
So let's say new study from Ioannidis. COVID's infection fatality rate in 2020 was less than 0.1% for those under 70, even lower than previously believed.
I believed it was low, too.
And I believed it was low. So that means 99.9% of people who got COVID in 2020 lived. In 2020, 99.9% of the people who got COVID under 70.
Is that the Delta times? Or
that was the original one. Alpha. I don't know what they called it. Maybe they did call it Alpha. So here it is, a new study. COVID-19's infection fatality rate by age of the team led by Dr. John Ioannidis, the world's most cited physician in the world, estimates that COVID's was under 0.1% for those under 70. He found that across 31 national seroprevalence studies in the pre-vaccine era, the median infection fatality was 0.0003%. So if you were 19 years or under, that was your fatality rate, 0.0000000000. And then if you were 20 to 29, it wasn't as good. It was only 0.003%. But if you were age 30 to 39, it got a little scarier. It was 0.011. And then if you were 40 to 49, your fatality rate was 0.035%. I fucking got in an argument with my brother and his wife over this. I was the wrong. I thought I was scared. They weren't as scared as me. And if you were 50 to 59 years old, you had a 0.129%. And if you were 60 to 69, that's when it jumps up. 0.5%. This comes out to 0.035% for those aged 0 to 59 and 0.95% for those aged 0 to 70. So it's even lower than 0.1%. Barely. It was even lower. Wow. So overall, according to the study, at a global level, pre-vaccination infection fatality rate may have been as low as 0.03% and 0.06. That is so low. Like it's not even 1%. It's not even 0.5%. It's not even 0.1%.
But it's hundreds of times more than...
Yes, that's right.
Let me just figure out how to interpret this, Jimmy.
That is how, remember how they used to talk about it? You're 100 times more likely to die if you're not vaccinated. But that's the kind of set... and the current analysis suggests a much lower pre-vaccination infection fatality rate in non-elderly populations than previously selected. Again, much like the flu, if you're not elderly or have comorbidities, you weren't at risk from dying from COVID. Ioannidis et al.'s findings represent a considerable downward revision from what was previously. They used to say 2 to 3% death rate. Remember they would say that shit, Kurt? I remember when they would say that. So I'm not going to read you all those numbers again, but again, super low, way lower than anybody thought. He's been studying COVID since 2020 when he published his prescient article in Stat News titled "A Fiasco in the Making." And now it looks like it was a fiasco because the fatality rate was so low. And now the case is almost obvious. Well, first of all, we know lockdowns didn't work.
We have to start going after people who said they wouldn't work.
So he said that it was a fiasco in the making. As the coronavirus pandemic takes hold, we are making decisions without reliable data. That is 100% true. So Dr. Jay Bhattacharya's colleague over at Stanford is right. And he was right in 2020 that they were just making up stuff like using masks, and they were making up stuff like social distancing.
We didn't know.
And lockdowns based on absolutely nothing. And then they told us all to take a vaccine because the vaccine would get us out of the pandemic. That was never true.
We can go back to our life. Just take it.
He also previously led the publication of a peer-reviewed WHO bulletin in late 2020, estimating COVID's overall infection fatality rate to be about 0.23% globally. And another peer-reviewed study soon after in the European Journal of Clinical Investigation, revising that estimate downward to an infection fatality rate of about 0.15% globally. So they knew this going back to 2020, that the COVID virus was not as scary as they were making you believe. And they're still doing it. There are still people who wear masks in comedy clubs, not the patrons, comedians. Still, because they still ingested the lie, and it hasn't been scrubbed out of them yet, and I don't think it ever will. When you see people with their masks on and wagging their finger at you about boosters, when are they going to stop getting boosted? Why would you ever stop getting boosted, Kurt?
I haven't stopped.
Right.
I did a show at Tell at Improv.
At the what?
At the Improv yesterday, or
you did?
or maybe the day before. But he goes, "Oh, thank God one person had a mask on in the crowd." He goes, "Thank God you have a mask. Someone needs to live to tell the tale of this."
Who said that?
Attell,
yeah. Someone needs to live to tell the tale.
He kept talking about third responders, the people that were bringing his DoorDash. He goes, heroes bringing heroes to heroes. A third responder.
The third responders. He's funny. All right, so there you go. They scared the hell out of you over nothing. They split up families. They had old people die by themselves. They injected kids with experimental medical treatments, all over nothing. But Kurt, you know the vaccine is a dandy. It's safe and effective.
It slowed the rate of hospitals being clogged up with useless, sick, poor people.
That's right. It did. It slowed the spread and the contraction, and it's fantastic.
Don't have enough beds, everyone.
Oh, it's the beds. It's not the...
Boost up.
Keep getting boosted. We're all for the vaccine. Slows the contraction.
What do you want? Take a bed that could go to someone else?
Hey, everybody, check out my new stand-up special, COVID Lies Are Funny, only $10. And come see us live in Syracuse, Cohoes, New York, Hartford, Los Angeles, Bakersfield, Baltimore, San Francisco, Huntington Beach, and more. Pottstown, even. Go to jimmydore.com for a list of all of our things, and see you there.